Hello guys, welcome to Essentials of Medicine. Today we are going to study about the classification of antifungal drug. But before going to study about the classification of the antifungal drug, you should know the basic structural component of the fungal cell wall, right? So here we are going to start with the basic structure of fungal cell wall. Now we are going to study about the different structural component of the fungal cell wall. Apart from this, we are also going to study about the certain antifungal drug which will act on the different structural component of the fungal cell wall. Can you see this outer line? This outer line is nothing but the cell wall of the fungal cell. This cell wall is made up of chitin, proteins and beta-glucan. But for the formation of beta-glucan, we require one enzyme known as beta-glucan synthetase, and this enzyme is secreted by the cell membrane. There are certain kind of antifungal drug, for the example echinokindins, which act on this enzyme and prevent its secretion. What happens if this enzyme is not there? Ultimately beta-glucan will not form, and this will prevent the formation of the cell wall. So we have done the cell wall, right? So now we are moving towards the cell membrane. Can you see this inner line? This inner line is nothing but the cell membrane. As we know that the cell membrane is mainly made up of lipid. Particularly we call it as a ergosterol. That is nothing but the structural component of the cell membrane. Now the question is how the ergosterol is formed. So there are series of events through which the ergosterol is mainly formed. The squalene is converted into squalene epoxide with the help of enzyme known as squalene epoxidase. And further, the squalene epoxide is converted into lanosterol with the help of enzyme known as 14-alpha-sterol demethylase. And through the multiple steps, the lanosterol will convert into ergosterol. There are certain kind of antifungal drug. For the example, terbinafine will act on this enzyme and prevent its secretion. Now, the another most important group of antifungal drug like azoles. Azole will act on this enzyme known as 14-alpha-sterol demethylase and prevent its secretion. What happens if these two enzymes are not there? Ultimately, the ergosterol will not form, and as we know that ergosterol is a structural component of the cell membrane. If the ergosterol is not there, then ultimately cell membrane will not form, and all the content that is present in the cytoplasm that will leak out just because of absence of cell membrane. So these are nothing but the mechanism of action of terbinafine and azole. So now we are moving towards the another most important group of antifungal drug, that is glycophylamine and flucytosine. So glycophylamine are nothing but the group of antifungal drug which will act on the microtubule. So first of all, what do you mean by microtubule? So microtubules are nothing but the small structure that is present in the cytoplasm and that is responsible for the multiplication of fungus. So the mechanism of action of glycophylamine is prevent the fungi from multiplication by directly acting upon the microtubules, right? Another antifungal drug like flucytosine, this will act on the DNA molecule and prevent the DNA synthesis. So the last antifungal drug that I want to cover here in this video is amphotericin B. The mechanism of action of amphotericin B is quite different as compared to other antifungal drugs. Amphotericin B generally prevents the growth of the fungi by forming pore in a cytoplasmic membrane. In part 1 of antifungal drug, we have discussed the mechanism of action of all the antifungal drug. In part 2, we are going to classify all the antifungal drug. So guys, here we complete the video. If you have any doubt regarding this topic, you can ask me in the comment section. But before this, if you like my video, then please don't forget to comment, like and subscribe to my channel. Thank you.
Audio Jungle.